Today, we have an important topic that's just come up here, especially affecting the San Francisco Bay Area. And that's this new street drug that has profound implications for understanding how our brain works, how addiction works, what this guy here has to do with it all, and importantly, what it might mean for those that are not only suffering from addiction, but also depression. Because this new drug called 2C or Pantera Rosa or Pink Panther is a fascinating but very dangerous concoction that this individual was found selling out of his donut shop called Yum Yum Donuts in San Jose, California. It's interesting because Yum Yum, this compound includes dangerous drugs in it. Ketamine, MDMA, methamphetamines, cocaine, and opioids. Yum yum, I guess, is right if you have that right clientele. This is dangerous. This is very serious. And I want you to know what it is, what the symptoms are for patients that might present to our emergency rooms who are taking this really dangerous new drug. You can see pictures of it here. And what addiction versus depression looks like. It's not by accident that they are often coexisting. And I want you to understand the shared mechanism that this drug, through its constituents in this really dangerous concoction, can actually help teach us so that we can not only better advocate for ourselves and our loved ones, but that we can perhaps take steps to make tangible impacts on our mental health, because mental health matters so much for our physical health. I see it in the operating room every day and in my ketamine center. So let's get started with how patients might present if they have taken this Pink Panther concoction. Agitation would certainly be one of the potential effects, especially from the cocaine or methamphetamine component. The paranoia can be there from the MDMA or the ketamine component. Violence can be from that meth component, and then sedation from the opioids in addition to the ketamine. So this is pretty much running the whole spectrum of what drug effects can be like. If you have questions about this, remember, we will have our Q&A live at the end. So I will try to answer some as we go along, but don't worry, we will address so many of them at the end. And hey, Sharon Sanders, shout out to you all the way from South Australia. Good to see you on here. Let's first start with the ketamine component. By the way, this was seized in that individual's, from his possessions once they found all the drugs there. Really sad story. Let's start with ketamine. That first component that I mentioned. Ketamine is a very unusual drug of abuse because it's a double-edged sword. Its effects on the body are heavily determined by the environment and the mindset in which the patient is taking that chemical. This is not like diabetes medications or blood pressure medications where you take them and there's more or less a pretty set effect. This will have a completely different effect. It can be one that's actually very healing from depression, anxiety, or even addiction itself, based on the mindset that one ingests or somehow consumes this powerful drug. If taken in rave settings and recreational settings, it will have a completely different effect. I show a picture here of an individual that symbolizes that stuckness that ketamine's potent NMDA receptor antagonism can actually help address. Now, it can be a source or a drug of addiction. We don't fully understand how ketamine is a drug of addiction. It's very different than the other drugs that are part of this Pink Panther concoction. Ketamine, when taken acutely, can have the risk of heart attacks, that paranoia that I mentioned, depending on the setting and the environment in which one's taking it. That risk of addiction is there, even though it's not a classic dopamine-related addiction. There's also a concern of kidney or bladder problems, especially in those that are consuming ketamine for long periods of time on the street. Let's move on to the second component, MDMA. This is what we call a serotonergic psychedelic. Its acute symptoms on presentation to an ER, if there's an overdose or if it's mixed with other components, can include that grinding of the teeth, what we call bruxism, blurry vision, sweating, that tachycardia because of its effects on the heart as well. Not too different in ketamine because it does influence norepinephrine levels or noradrenaline levels. That's similar to adrenaline or epinephrine, which I'm sure you've heard of. Then there's this concern of valvulopathy in long-term users of serotonergic psychedelics. So not quite ketamine per se, but MDMA, psilocybin, etc. There's a risk for the effects that serotonin has on your heart, not on its heart beating per se, but on the heart valves actually. So valvulopathy refers to the thickening, particularly of the tricuspid valve. When there's a lot of serotonin circulating in the system, we see it in certain tumors that release serotonin as well. The environment that you're taking MDMA in also has a profound effect. Unlike the others that we're going to get to, this can potentially be used for healing. It's studied very extensively in the VA population, in our vets, because of what we call its empathogenic properties. It is being studied for PTSD. Many believe it will be approved for use for PTSD in the coming years in the United States. So a lot more we're going to learn about MDMA. But when used in this type of setting, along with other drugs like cocaine that are part of the Pink Panther cocktail, does not necessarily have those healing effects, to be very, very clear. Speaking of cocaine, that is the next drug here. Cocaine actually comes from a natural derivative, the coca plant. You can see that in Colombia. We all know about Pablo Escobar, etc. Many of our medications today are actually derived from cocaine, like lidocaine, bupivacaine, novocaine, etc. They do not have the same potent dopamine reuptake inhibition that cocaine has. We actually use cocaine still in its form in the nose for ear, nose, and throat surgeries because of its powerful, what we call sympathetic nervous system activation. Now, when it's used locally in the nose, meaning you just put a pad with cocaine soaked in it in the nose, it will constrict blood vessels. But when it's taken systemically, meaning it hits the whole body, that same sympathetic nervous system activity can cause arrhythmias, can cause blood pressure by constricting the blood vessels everywhere in your body, not just your nose like we do in ear, nose, and throat surgery. It can lead to heart failure, can actually have profound consequences if used before surgery. So we're very, very, very careful about not doing elective surgery in individuals who have taken cocaine or who are high on cocaine. Now, that dopamine reuptake inhibition, this is powerful to understand its mechanism of addiction. This is totally different than ketamine or MDMA. This demonstrates how cocaine overwhelms the body's natural anti-addictive mechanisms. Yes, your brain and body have mechanisms to minimize the risk of something turning into an addiction. This is normal and healthy. It's called reuptake of dopamine. So over here, you'll see a picture of what's called a synapse, where one side, one of those little feet, if you will, is releasing dopamine. The other foot, or the other plateau that you see there, is receiving the dopamine with what's called receptors on the cell surface. Cocaine not only leads to release of dopamine from one neuron to the other, and when the other neuron there receives the dopamine on its receptors, it gives you that sensation of pleasure. But on top of that, cocaine prevents the reuptake of dopamine. The cell that releases the dopamine doesn't want to just leave dopamine there forever because you will stay in that pleasurable state and not want to do anything. You'll simply die. It wants to remove the dopamine that's been released so it's not just sitting there forever. Cocaine inhibits that effect. It blocks the reuptake of dopamine, leaving dopamine there for much longer than it ever should be. When it stays there forever, it overwhelms your brain's ability to come off of that high in a safe way. Not that there's really any safe way of using cocaine in the first place, but the idea is that it is it's almost like chemically designed to cause you to stay in a state of euphoria for as long as possible, overwhelming your body's ability to remove excess dopamine from that, what we call synaptic cleft. If you recall, meth was one of the other medications that was a part of this Pink Panther cocktail. It acts in many ways similar to cocaine as an activator of the sympathetic nervous system. One of the big differences we see in long-term meth addicts is that their teeth are destroyed. This is partly from the vasoconstriction, just like cocaine has. that can lead to the arrhythmias, the high blood pressures. The same thing can happen with meth. When it's consumed around the oral area, its vasoconstrictive properties will cut off vasculature or make your blood vessels very small to supply your gums. And if you reduce the blood flow to your gums, eventually they will die. Tooth decay, etc., will be one of the consequences. Just like those who snort cocaine, how eventually their septum will thin because as you constrict blood flow to those areas time and time and time again, they get less nutrients, they will thin out, and that tissue will die off. So perforated septums are not uncommon in long-time cocaine users. But now let's talk about the last component, the opioids, part of this deadly Pink Panther cocktail. What a terrible name, right? If you're learning something new, and we have a lot more to talk about the depression and addiction part once we go through the chemistry of these molecules, if you're learning something new, please share what you learn with others so that they can better advocate for themselves. There is so much that we can all learn about our mental health through addiction, and I'll explain that in just a moment. My patients find this so powerful, so I want to share it with you. So please take what you're learning, share it with your loved ones, empower yourself. If you are learning something new, please hit that like button and consider joining our live access, our private Zoom streams. We have one coming up right after this after this live stream, actually, where I get to answer more of your personalized questions in a more individualized setting, more personal setting, and you'll be able to learn more about the different medical secrets that you probably don't get to ask your doctor at the doctor's office. But let's move on. Opioids come from the poppy seed. They're also a natural, as you know, drug out there. Opium is derived from the unripe poppy seed, and morphine is actually naturally derived from that. Now, fentanyl is a synthetic opioid. They absolutely have potent anti-pain properties, but they also can cause powerful dopamine release cycles that can be near impossible to break without the right internal and external support. Well, this leads us to what's called the endorphin system. The endorphin stands for endogenous morphine. We first discovered morphine from the poppy seed, and we made fentanyl and other drugs from it outside the body, but it was discovered like a century or two later that the brain and spinal cord produce their own version of morphine called endorphins. So we called them endogenous morphine. They also bind to opioid receptors throughout your brain and spinal cord. And this is fascinating because it explains a little bit about that hole. The hole is what we are trying to fill when we have been afflicted with traumas in the past, little t or big T traumas. The hole represents what has been lacking from our lives in the past. In the case of endorphins and opioids, it's relatively easy to paint a picture. I'm not downplaying or making light of any of my patients' struggles, but it's not uncommon to see an individual who did not receive the natural endorphin activation as a child, either from traumas like physical abuse, sexual abuse, seeing a parent beat up, seeing a parent go to jail, seeing parents use drugs. When you're in that vulnerable state with the power differential with the adults in your life, your parents and family and teachers are going to be the most common. If there is not the appropriate endorphin release that not only comes from the runner's high, which is what most people think about when you exercise, you release these endogenous morphines, these feel good molecules, but they also come from social interactions, especially from parents and loved ones. If those are not there as a child, there's kind of a hole for what those endorphins should have developed in your brain and body. That hole can then be filled with other opioids that agonize, meaning they activate the morphine or the opioid receptors throughout your body. Fentanyl does that. Heroin does that. These components of Pink Panther do that. They are like what we call a cheap back door to trying to fill this hole that didn't develop properly at any point growing up. Now, as a child, when the critical window of neuroplasticity is at its peak, meaning you are learning to walk and talk and be loved and show love. If that doesn't start at that moment in life when your brain is at its peak, neuroplasticity, meaning it's learning the most, well, that hole will persist. And external drugs may then feel like that warm, cozy blanket, like how Gabor Mate describes it. And it's not by accident how much adverse childhood experiences correlate to the risk of future addiction. Now, this also raises the question of seeking. What are patients seeking when they're going after the cocaine that I mentioned, or the meth, or the opioids, or the ketamine? The seeking is something to fill that hole. So when patients come to me in my ketamine infusion center, yes, that's correct. Ketamine, despite being a potential drug of abuse, can have profound anti addiction properties when used responsibly and mindfully and ethically. What I want my patients to understand and discover within themselves is what is it that they are seeking. If they can find where that hole lives within them, and no, I don't mean this in a woo-woo, crunchy granola way. I mean in a very pragmatic way that can transform the lives of high-functioning individuals who have found themselves slaves to slot machines, to online sexually explicit content, to Amazon shopping. They have found themselves triggered by the sight of these things to have to undertake those addictive behaviors. And now my question for you is how different? How different is this if you are struggling with staying up at 3 in the morning because of these ruminating, perseverating thoughts in your brain? If we define addiction as someone who has is using a substance for short-term gain at the expense of long-term harm, and they can't hit the abort button, we understand that for drugs, sure, and slot machines. But what about that person at 3 a.m. who has this thought that comes up that triggers and sabotages their central nervous system? It takes them into this spiral of thought that they cannot abort out of. How different is that? How different is that than the alcoholic who's triggered by a shot of whiskey that they see, to have to take that shot of whiskey, that behavior? Well, in this case, the trigger is internal. Maybe something came up. Maybe some person that really pissed you off or someone that really hurt you, a betrayal of trust. Their thought comes up, bubbles up. The water over the dam is how I describe it to my patients. And that launches you into this almost addictive quality where you're stuck in this loop. Just like how the alcoholic is stuck being a slave to that shot of whiskey every time they see it, or the coke addict who sees this Pink Panther and goes after it, seemingly unable to stop. What happens when we're stuck in these thoughts that race in our mind? How different is that? Well, I ask you this. Ghrelin that I've written here. Ghrelin is the hormone that controls your hunger. When we are hungry, ghrelin is released, reaches our brain, and stimulates us to want to eat. Well, when we are full, the brain wants us to stop eating. So it will reduce ghrelin levels circulating in your bloodstream so your brain sees less ghrelin so that you stop eating. Well, that's just like the dopamine reuptake that we talked about with cocaine. You see, the body has all sorts of mechanisms to keep you within a balanced range in life. It's like a gyroscope, is how I describe it to my patients. It's spinning on its axis. And if it gets popped off its axis, it will try to right itself if it has the right internal and external support. The body wants to heal, right? If you get warm, you will sweat to cool down. If you get cold, you'll shiver. Your body's always trying to maintain what we call homeostasis in the West. Wants to keep you healthy. These drugs take advantage of a time that our gyroscope is not able to balance itself. It doesn't have the right internal and external support because of these holes that society and maybe our loved ones have put within us. We in Western medicine try to play whack-a-mole, trying to fill them with maybe SSRIs or maybe Xanax or maybe Wellbutrin. And there's a time and a place for these medications. But if we're just trying to fill holes with Band-Aids, we're probably not going to have a long-term solution. Versus if we actually addressed what is somebody seeking. What is somebody seeking brings us to the concept of flexibility and rigidity. Can we help somebody be flexible like a willow reed as opposed to rigid like the oak tree? The analogy I share with all my patients. The addict is rigid. When we are in a deep depression or deep anxious state, we become rigid. I'm not blaming patients, it's not their fault. But we need to understand that when we are rigid, we have no room to separate ourselves between stimulus and behavior. So just like how that alcoholic, when they see that shot, they have to take it. They don't have the presence to think, oh, should I take it? Do I have the ability to not take it? No, they're stuck. Literally, the space between stimulus and behavior is glued together. They're stuck. They're like the willow, like the oak tree. They can't do anything other than be a slave to what their reflexive habit loops are pushing them to do. And when they try to make a difference, something snaps, like that oak tree. They'll go into withdrawal or relapse, etc. If it's the depressed individual, they'll stay stuck insomniatic. They come to me with insomnia. And is the true diagnosis insomnia or is it depression? Because there is this loop, this rigidity. We're stuck in these loops of perseverative and ruminative thoughts, where even the mere thought of someone who angers us throws us into this loop of frustration and irritation and anger. Once again, stimulus and behavior are glued together. How can we induce flexibility so that we can break these loops, not snap them like the oak tree? That leads to bad things, but to be flexible and resilient like that willow reed. In the storm, the oak tree branches snap, but the willow reed is supple. When my patients come to me from Florida or Southern California, I talk about palm trees in the hurricanes. They have that flexibility. How can we help those with addiction or those with depression or those with anxiety or those with OCD or those with PTSD? They all share the same underlying theme about being rigid, not fault. I'm not attributing blame. I'm not making light of anyone's past traumas, but the end effects turn us rigid and hardened. Our gyroscope is unable to right itself. And this is where true medicine will address the root causes of why have we become stuck? What is the hole that we're trying to fill? Whether it's with Pink Panther or whether it's with a laundry list of SSRIs and SNRIs and TCAs and benzodiazepines, there's a time and a place for the medications. There's not a time and a place for the Pink Panther. But we need to address the root cause. That's what my patients deserve. And I hope that you can advocate for yourself the next time you or a loved one is in this stuck, rigid loop with your doctor. That being said, if you learned something new, please hit that like button. I would love to answer some of your questions before we need to go. K or M Henderson, I'm happy that that it resonated with you, this gyroscope analogy. It's very powerful. I hope it gives us hope that we can find healing. I don't get the point. Is he saying that these drugs or medications are able to help those with PTSD? Well, medications can help with PTSD. And that's a whole different topic that we'll have to talk about in a different live stream. But the individual with PTSD, I urge you to consider how different are they a slave to triggers compared to the alcoholic? So, Mama Lena, think about that alcoholic who, when they see that shot of whiskey, they have to take it. There is no separation between stimulus and behavior. Then compare that to my patients that come to me in the 4th of July, the veterans, for whom the fireworks are a trigger for this hypervigilance, this high heart rate, this high blood pressure. Are they a slave to that trigger as well, Mama Lena? I find that there's a similar shared underlying theme where they are stuck in this loop where a trigger causes a behavior, whether it's fireworks, whether it's Amazon shopping, like I said, whether it's cocaine. That is the underlying similarity, and treating that involves a compassionate view to help restore flexibility to break that rigid cycle loop, that stimulus and behavior loop. It's different for every individual. I personally use talk therapy and IV ketamine therapy for my patients, but there's many different ways through meditation, etc. But these medications do have a time and a place. The drugs like Pink Panther do not. I hope that answers your question. Rafi, thank you so much. A bit of an unrelated question. Could you cover how certain supplements like black seed oil can impact anesthesia? Byzantine, that's a very good question, but quite different than what we're talking about today. Let's save that for a different live stream. D, thank you so much for the kind comment. Rose, It's so refreshing to hear you speak of addressing the root cause. Well, I am so happy that that resonated with you. And Libra, I'm so happy that you also appreciate this. Hey, go Niners today. Absolutely. You know that I practice and live in San Francisco, so I am absolutely rooting for the Niners. And can ketamine stuck you too? Well, I'm sorry about what happened to your son. Unfortunately, ketamine, like MDMA, like other psychedelics, how it affects your body is entirely a function of the environment in which it is being used and the mindset it's being used with. So it can have absolutely negative consequences, no question. But that's why the responsible and ethical use has to come first. I'm so sorry about that. Needle fear, absolutely. I will do a video on that. Jay says nature can be a great therapy. Yes, Jay. And in fact, Shinrin-yoku, you should look it up. Shinrin-yoku, it refers to forest bathing, the Japanese word about literally letting nature cleanse you, has powerful, powerful effects. Even for my patients after surgery, whole different topic we'll talk about, but I encourage you to look it up. Sean, you are so welcome. No problem at all. No problem at all. My thoughts on kava and kratom. Kratom, very dangerous. The FDA actually has asked us to not to be very vigilant because of contamination with synthetic opioids. Cannot recommend that. Kava has the very rare side effect of liver toxicity, very rare, but is a social lubricant, much safer than alcohol, that's for sure. You can talk with your doctor about whether it's safe for you. I do recommend it to some of my patients. Kava root, very good question. Mando is doing well. Thank you for asking, Rafi. And you are so welcome, Ziva. It is a very, very powerful and safe therapy. Can ketamine therapy help with benzodiazepine deficiency or dependency? Well, unofficially, no. Officially, no. Unofficially, yes. But it has to be done with a doctor who is trained in how to use ketamine to help break that cycle, that loop of stuckness and rigidity that someone with a benzodiazepine deficiency or dependency is falling victim to. Very good question. Is Pepsid addictive? Not as far as I know. And Heather, so good to see you. Go Niners. Go Niners. Do I think withdrawals is what keeps an addict an addict? That is one of the prevailing theories in addiction theory. Absolutely, that the withdrawal leads to cravings, and cravings will predispose you to consuming the drug again. Absolutely. I'm so happy that you learned so much. And we'll end with Dog Defender because I love your username. And I love how you're being supportive of Sean. That's fantastic. Hey, if you all learned something new, do please hit that like button and share what you learned with others. Help empower others in our broken healthcare system that is not helping our patients with addiction, with depression, with PTSD. Address the root causes of why they are stuck. And if you want to join our exclusive access, the link will be below to come into our private Zooms that I'm going to hop onto in just a minute here. Your support means a lot. And I hope that you have a wonderful weekend. And remember that you have more power over your health than you've ever been told. Until next time.